to the humerus and similar parts. You have a very, very easy to see head and a very, very easy to identify neck. And on the humerus we had a head and a neck, and then we had two bumps. And you got the same thing here. You got a big bump here and a little bump here. They were called tubercles, right?
Yes.
On the humerus, on the femur, they're called tuberosities. Okay? You have the greater, they're called trochanters. Tuberosities. How am I talking about? Is this anatomy and physiology?
Yeah.
Okay, sorry, that was a different class. Trochanters. Greater trochanter and lesser trochanter. The big one, greater and lesser. Remember on the humerus we had a groove in between the two tubercles?
Yeah.
Well, we don't have a groove. We have actually a bridge of bone that connects to this bridge of bone here. It's called the between the two. Intertrochanteric, between the trochanters of crest, right over here. Crest. Not the line, forget the line, the crest. Intertrochanteric crest. So here's the greater trochanter, here's the lesser trochanter, and they're connected by a bridge of bone called the intertrochanteric crest. Shaft or diaphysis, and then we come down to the knee joint. The anterior side of the bone is very smooth, and the posterior side of the bone has a sharp ridge on it. Okay, it's called the linea aspera. Linea aspera, the ridge on the back of the bone. Front is smooth, back has a ridge. So again, orientation. Front is smooth, back has the linea aspera. The head always faces medially. The head always points medially. And that's the front smooth, so this is my right femur. So that's going to help us down here because we need to know which is the medial, which is the lateral. On the humerus we had a condyle. We had a joint surface. This is all covered with cartilage here. This is the joint surface of the knee. May I have your tibia, please?
Tibia.
Thank you. The knee joint is between the tibia and the femur. The fibula plays no role in the knee joint, unlike in the arm where both connected to the humerus. Only the tibia and fibula, the tibia and the femur connect together, forming the knee joint. There's two nice smooth plateaus here on the tibia that fit onto these nice rounded condyles of the femur. And as you can see, one is called the medial and one is called the lateral condyle. Head is on the medial side, medial condyle, and lateral condyle. And look, there's a nice deep groove between them called the intercondylar fossa, the fossa between the condyles. And like we saw in the humerus, was there an epicondyle? Yes, there was. Lateral and medial epicondyle. Here's the medial, it's a little bigger, like on the humerus, and the lateral epicondyle. They go on to talk about supracondylar ridges and all kinds of stuff, extra stuff. We're going to stop there. Medial condyle, medial epicondyle. Lateral condyle, lateral epicondyle. Intercondylar fossa. Shaft or diaphysis. Linea aspera. Greater trochanter, lesser trochanter. Intertrochanteric crest. Neck, head. Okay. Look at the head. See this indentation here? Fovea capitis. There's a ligament, what we call intra-articular ligament, meaning, see that? Now there are ligaments around the outside that lock this to this, but there's also one ligament on the inside that attaches from that to that and also helps lock it in. We have those in the knee also. You ever have the anterior and posterior cruciate ligaments? They're right in here. They crisscross in here and they lock this to this. And then there's also ligaments around the outside that lock it together.
When you get water in the knee, that's the cartilage that gets water in the knee?
It's swelling, right. Yeah. Can I have your patella? Patella.
No, that little tiny bone. Where is it? Oh, that. Oh, that's right here, right?
That's your kneecap. Your patella. The kneecap. Okay? It's a sesamoid bone. That's where it goes, right there. There's a surface for cartilage.